There has been a huge amount of interest in using blood-based tests to help us understand more about a patient's cancer biology. We've known for many years that tumor cells do circulate in the bloodstream, and we can measure these. And in the last few years, we've shown that the presence of circulating tumor cells does predict for a much worse outcome and shorter survival in patients with metastatic breast cancer. And on this basis, assays now have been commercially approved where one can detect and enumerate circulating tumor cells. There was a very interesting study done by the Southwest Oncology Group to see if this can actually help with patient decision making. Patients who were starting first-line chemotherapy for metastatic breast cancer had their circulating tumor cell counts done before therapy, and those that had a high number, over 5 circulating tumor cells per 7.5 mils of blood, were then followed after their first round of chemotherapy. Their first cycle, had their blood rechecked, and if they were still high, then they were randomized to either have their treatment changed because their CTC counts didn't drop, which we know is associated with a poor survival, or to be followed in the standard way we would follow a patient, which is to get another scan after 2 to 3 cycles, and then make the decision if they're progressing, change therapy. And this study did not show that patients' outcomes were improved by using CTCs to make an early decision. So at the current time, we are still struggling to find a role for CTCs in decision making. Yes, it is prognostic, but does that actually affect how we treat a patient?